Thank you for joining the Asheville Rise Stronger Together podcast. This is your host, Jessica Knupp with the Asheville Area Chamber of Commerce. I hope you enjoy today's episode.
Hey everyone, thank you so much for joining us again today. We are continuing on with our Women Who Lead Building Community Through Business series, and today we have Alicia Heacock from Babies Need Bottoms, and we are so thrilled to have you here and to learn more about your organization. And yeah, let's just kick it off.
Thank you. I'm so happy to be here. Thanks for having us.
Absolutely. So if you can tell everybody kind of what you guys do, what your mission is, and kind of also like how you got involved with the organization.
Sure, yeah. So we are Babies Need Bottoms. We are a nonprofit 501c3 diaper bank. We are the only diaper bank that is currently in Western North Carolina.
Like all of Western North Carolina.
All of Western North Carolina. We started here in Asheville in 2017. So our founders were a lovely couple who had kids, who moved to this area. They had 2 kids in diapers at the time and just started it out of their apartment because they realized there wasn't a diaper bank here.
Yeah.
And they knew how important it was in the community that they had moved from, and so they started it.
Wow.
Yeah.
How did you get involved?
So I saw an article in Citizen Times that had said there's this new organization starting, and I had a 10-month-old baby at the time,
In
so
diapers.
I knew how important diapers were.
Right.
My family had just moved to Asheville a couple years prior, and so I had a background in nonprofits, I had a background in fundraising, and I thought, oh, this might be the thing. So I wasn't working at the time, so I thought I have time to volunteer. And luckily for me, there was another woman in town named Megan, who's my co-director now, who also saw that article in the Citizen Times. So the two of us came on as board members, and fast forward a couple years later, we ended up taking over, and so now we're co-executive directors of the organization.
Oh, I love that. You know, having a child who's been in diapers, like, it's a lot.
It is.
I mean,
yes.
what on a daily, like, what does it look like for you guys and out in the community? Please share.
Yeah. So I'll actually back up for just a minute, because one of the things that I find so compelling, which is a big reason why I am so committed to this organization, is that I did not realize that diapers are not covered under any of the poverty alleviation, social safety net programs, whatever you want to call them. So if you're on SNAP, food stamps, if you receive WIC benefits, anything that as a society we have already decided that we need to have somewhat of a safety net for families so that those basic needs are met so they can survive and thrive, right? Diapers are not covered under any of those. And actually here in the state of North Carolina, particularly here in Buncombe County, we pay the highest sales tax, 7% on diapers. So there's a number of states across the country that have repealed the diaper tax. North Carolina is not one of them. And like I said, Buncombe County, we pay the highest sales tax. So diapers are not covered under any social service program. They're taxed actually as luxury items, if you can believe that.
Luxury.
I know, right? And there's really nowhere to turn if you can't afford them.
Right.
They're incredibly expensive,
So
too.
expensive, yeah.
So if you have someone in your life that has a baby and they're going to need support with those diapers, even if you have all the resources in the world, it can be a hard thing to keep up with. I had a premature baby, and I couldn't get preemie diapers. I didn't know I was going to have him early,
Sure,
right?
exactly.
So we actually had friends who went to the store to try to find diapers for us so that we would have diapers when we came home from the hospital. They weren't on the shelf. They couldn't buy them. We had to order them online.
Oh my gosh, and still waiting for them.
And still waiting, yeah.
Yeah.
So,
I mean, like, and when you need a diaper, you need a diaper.
you need
like,
a diaper, you need a diaper. Yeah.
Yeah.
Yeah, babies don't keep, is what we say all the time, right? You know, like they need diapers, they need formula, or they need milk. You know, they need things very immediately. So if you don't have them, it's incredibly stressful for that caregiver. Yeah. And so if you think about a newborn, a lot of people don't realize they need that diaper change like 10 to 12 times a day. So you are constantly either feeding or changing that baby.
I try to put that out of my mind for a little bit. Like,
Yes.
You know, it was constant. It's just, I mean, you could, what is the average? Do you know? Like how many diapers
you need a month. Well, so the daily average for a newborn is 10 to 12. As they get older, it's less and less in theory, right? Unless like you're sick, right?
Like
yeah, it doesn't feel like that as a parent. I get that. But on average, the cost is about $80 to $100 per month per child to cover diapers and wipes. So if you think about you're spending like $1,000 or more a year, that's a huge percentage of your take-home pay, especially if you're working a minimum wage job.
Right.
So diapers are expensive. There's no social safety net that covers them. So that is why diaper banks like Babies Need Bottoms exist. And so we're a standalone diaper bank. We are our own 501c3 organization, but we are a part of 2 national networks of diaper banks that are around the country. Okay. And we have all emerged as this grassroots response, mostly because moms have babies and look around and say, oh my gosh, I didn't know how hard this was. I didn't know how expensive this was.
Right.
And what in the world do people do if they don't have either, money in their pocket to buy diapers right now, access to credit so that they can order online and have them shipped to their door, a car to go to a store to put that box of diapers into their car and take home. I mean, if you're taking public transportation and you have to go get diapers with a baby in tow or a baby and a toddler in tow, how are you going to carry all that? So then you end up buying the smallest size, right? Because you take what you can carry.
Sure.
And here's the other thing about diapers. You are benefited if you can purchase like an economy of scale. So if you can buy that big month-sized box and have it shipped right to your house, you're actually paying less per diaper than if you go to like CVS or Dollar General or one of those stores and buy the convenience size pack, right? Yeah. So there's a lot of things that are making diaper need, which is what we call, that's the term that we use to describe when you don't have enough money to cover the number of diapers that you need to keep your baby clean, dry, and healthy. And so there's a lot of factors working against parents who are trying their hardest, right? We have a deep-seated belief that the parents that we are serving are trying their hardest. They want what's best for their kids. And as a society, as a community, what does it say about us that there are a lot of barriers to families having access to those things and having to make difficult choices between food, rent, and these hygiene products that are so essential for health. Right,
exactly. Oh my goodness. I mean, that is just, it's amazing. I mean, when you think about like some, how easy it is to get certain things, but then when you need it and you can't get it. I mean, it's just, what a wonderful organization that you guys have. What about when you're partnering with other, I mean, I follow you guys on Instagram and I love everything that you guys are doing. You guys do tons of partnerships, especially with businesses. Like, what does that look like?
Yeah. So I'll talk about a couple of different ways that we partner. So part of our mission, our mission is that we are here to serve babies, toddlers, parents, caregivers with diaper distribution. So that was like the main focus when the organization was founded. But also the other 2 parts of our mission are community awareness, so that people understand why diaper need exists, what it is, and that we can do something about it, even if our government isn't the place to do it.
Right.
This is a grassroots response. We do think that there is a role of policy, but what we can do on a local level and working with individuals is a lot different than that. So the awareness building is more just letting people know what this issue is. And then the third part of it is partnerships. And we think about partnerships in a couple of different ways. The first is our distribution partners. So when this organization was founded, there was a huge realization that in order for it to be successful, it couldn't duplicate efforts. There are so many amazing nonprofit organizations in this region, right? Like that is, it's so valuable. And so for us, it's very important that we're not trying to duplicate. We're not trying to take over any space and do the same thing that other organizations have been doing for much longer and doing much better than we can. So what we want to do is we want to strengthen those organizations and help better resource them so that they can meet more of the families' needs that they're already serving.
Right.
And so that partnership-based model, we didn't come up with it, right? This is a national best practice. So we are just implementing it here because it didn't exist before. So when we started, we went to organizations that were here already working, like Helpmate, and asked them, would you need this? Do your families need diapers? And overwhelmingly, we heard yes.
Yes, like multiple.
Yes.
And you guys work with Catholic Charities too, right? Because I know I was there for a work meeting, and she was bundling some diapers that somebody had brought, or had, we can talk about that later, but so that's wonderful.
So we are up to, I'm going to say, approximately 80 different partner organizations that we're serving throughout 18 counties of Western North Carolina. And I will say that the hurricane and COVID changed things wildly, right? Like, we are now living through two major events that have changed the course of the diaper bank. But because we have this core partnership-based model, it has allowed us to build our capacity in a way that is only real because of those amazing partnerships, right? So organizations like Catholic Charities, like Helpmate, like Mana, like Verner, like all these amazing organizations that are already doing the great work that they are. Once a month, we say to them, how many diapers do you need? What sizes do you need? Who are you serving? And we ask them questions about what they're seeing in the community. So we've been able to track over time what diaper need looks like in Western North Carolina. That had never been done before, right? Yeah. Diapers are so expensive, they don't usually have their own budget line item, right?
right.
Even if you have a big organization, it's more that we were finding that organizations that were serving families with young kids, they could meet their food needs. Maybe they were helping them with shelter and food, but diapers were something that they would just try to piece together. Oh, this family needs a box of size 5 diapers. Well, let me go to Ingles and see if they'll give me a gift card so I can buy diapers.
Right.
And, that's great. That's a good starting place, but it's not sustainable, and it's not meeting all of the needs. And it's really not getting at the heart of the matter, which is this is a pervasive and often hidden issue. And so our organization is able to come in. We're able to talk directly to these partners every month, fill their needs to the best of our ability every month. And then also hear from them, what are they seeing? What are the stories? What are the barriers that families are facing? And so when you're talking about working with businesses, the story that comes to my mind is, so my co-director, Megan, I wish she was here with us because she's good at telling this story. But so she's a social worker by training. You know how I said we don't give out to individuals, we give out to organizations?
Right.
Well, sometimes we do hear stories of individuals because we have partnerships with social workers. And so the social worker in her and the social workers in our organization, they're not going to let that family fall through the cracks when we hear about it. So we have like an emergency response diaper program where we get this call from a social worker that says, one of my moms is a waitress. She showed up at childcare. She didn't have enough diapers in the cubby because childcare, they don't have the resources to provide diapers. The families have to, right? Yeah. Well, you can't take your child to daycare because they are state mandated to change that diaper every, I don't know how long it is, but they have to change it on a schedule. So if you don't have enough diapers in your cubby, you can't leave your baby at childcare. And this is not to demonize the childcare providers. They are doing as much as they possibly can. But in that instance, that mom needed to go to work to be able to buy the diapers. So we were able to, Megan met this social worker in the parking lot before work so that she could get those diapers to that mom so she could go to work. So these are the kind of experiences that we're seeing on that, basic level where you may not have ever had that experience yourself, but you can understand how important being able to take your child to childcare and leave that child at childcare is, so you can make a living for your family.
Yeah, make a living, pay for them to be there, because that's not cheap either. So and then just the stress. Well, the stress of being a parent, and then to know that that's kind of over your head as well,
Yeah. It's a lot to carry for one person. And a lot of times these are things that, there's shame attached to it. I can't provide for my kid. I don't want people to know. Right? And so part of what we want to do is we want to take away that stigma. We want to say, this is available. And you don't have to, there's always going to be people that are, have more or less needs than you. But we want to be able to flood the Western North Carolina region with access points for diapers so that we are taking away that stigma, so it's easier for families to access what they need so they can stretch their household resources. Because we all know, especially now, there's not enough, right? There's not enough. So we really are invested in this idea that to be a community that thrives, right, we need to be aware of what families are facing, even when it's something that they don't want to talk about in a public way. We're not going to put a family that received diapers, out in front of us. But we will take that anonymous story. We will try to share that story so that people can understand, can relate, and can see where all these pieces are in the puzzle that makes our community better, makes our community stronger.
Yeah. as you're talking about all of these things that you do, I'm like, what does your staff look like?
That's a good question. I wish we had more.
I'm sure. I mean, like, in my head, I'm like, that takes like hundreds of people to do all of these things.
Yeah, but so, I mean, passion really can get you places.
Yes, absolutely.
But that is not sustainable. So it is a good question. So the Diaper Bank started as a volunteer-only organization. I mean, that's how most nonprofits start. Sure. You have, Megan and I stepped into the role. We had like $142 in a bank account we didn't have access to. We talk about that all the time. Like, what were we thinking? This was insane. But we also have an amazing community of funders who sees the value in the organization, in the mission. And so we have been able to grow over time to a place where we are no longer solely volunteers, thank goodness, because I don't think that we could exist in the long term if we weren't. Right. We are so happy to say that we also pay a living wage to everyone who works for us as employees. It was just Megan and I part-time for a long time. And we do share a co-leadership model, which I will say for the nonprofits in town, and maybe for the for-profits too. I mean, a co-leadership model has given us the ability to be flexible in our decision-making and supportive. Right. And I think especially having gone through COVID and Helene in this short time period, the amount of burnout and turnover that we have seen in our partners is tremendous. Right. And we're all feeling this level of stress in the world that is really hard to deal with. But when you have a co-director, someone else that is in that same position, and while we do have some division between our specialties, we can feed off of each other, we can go back and forth. It really makes a huge difference in that we can do this together model. Right. And so we're very excited that we actually have 3 staff and everybody is part-time.
That's great.
Everyone is part-time. Everyone is also moms. So get it from this fundamental way. And we also have a working environment where children can be with us. They had to. In COVID, my son did COVID kindergarten in the Diaper Bank. Right? His Zoom classes were in the Diaper Bank. So we have developed this organization in a place where you don't really always understand that you have control to make these decisions in a different way until you're the one that gets to make those decisions. Right. And so now we're trying to create an environment that is flexible, that if, your child has to be picked up from school, our staff are supported so they can do that. These are the types of things that when I worked for bigger organizations before where I wasn't in a leadership position, I just didn't understand that it could be different. And I know it's not possible for everyone in this current climate to just go ahead and make a big change like that. But I would encourage anyone who is listening to this to think about what the mental health benefits are to your employees if you have an environment that recognizes them as whole people who are not cogs in the wheel, right? And that's not the Asheville way, right?
No, it's not. Not at all.
So, but recognizing that people, if they're happier and they get more fulfillment out of their job, a big piece of that is being able to take away some of that stress of what if my kid is sick, or what if I'm sick, or any of these things that can come up in our lives. So for us, it's that piece of it is just so important. And I would also say that from a board leadership position, we have also tried to bring that mindset to our boardroom. Our boardroom does not look like many nonprofit boards. I'm going to tell you that. We lead with passion. Because having people at the table who really care deeply about the issues is the most important thing. For us, we see it as a training ground. So most of our board members have never had board experience before. Some of them have, some of them haven't. But we try to train them on the job, so to say. Because we want them to come out empowered. We want them to come out understanding, what a fiduciary responsibility is. We want them to come out being able to read a profit and loss statement. We want them to understand what the mission is and how we're fulfilling it and what a board member's role is versus a staff member's. And so we're really trying to see this organization. We're not just serving families who don't have the resources that they need to afford diapers. We're trying to serve people at lots of different avenues and lots of different ways to enrich their lives, enrich the community, and think of this more of a holistic part of the community in that way.
This is just amazing. Like, everything that you guys are doing, I mean, just hats off. I mean, that is just great. I mean, we talk about all the nonprofits, wonderful nonprofits that we have in this area, as as I'm talking with people to join the chamber, they're like, do you have any nonprofits that are, and I'm like, almost every nonprofit is a member of the chamber.
Absolutely.
And, and I remember talking with you about coming on and kind of what those resources, could potentially look like, and making those partnerships with other businesses to help. With maybe it's a fundraising, or maybe it's, facilitating the diapers and things like that. So is there anything else that you would like to share with us today?
Yeah, so just speaking about the relationship with the chamber and our nonprofit and the business community here in Asheville and around. So we really value the business community and the relationship that we can have to build a better community. So we have a great volunteer program. We're actually expanding our volunteer program this year. I know, we're very excited. Cool. Yeah, so
How many volunteers do you guys typically have?
That's a good question. I have no idea because the hurricane ruined my data.
Hurricane.
We have here, so you can edit that out or you can keep it. But the hurricane did change things for us. Just as like a side.
It just changed everything.
I did run our diaper distribution numbers yesterday, and I was looking at last year, and between Q1 of 2025 and Q4 of 2025, we saw a 123% increase in the average monthly diaper distribution. So before the hurricane, we were distributing between 40 and 45,000 diapers a month.
40 to 45,000.
Yeah, diapers a month.
And that's all 18 counties?
Yep, that's all 18 counties.
Wow.
The last 3 months of 2025, we distributed nearly 100,000 diapers each of those months. So the growth has been tremendous.
Yes.
And this is not because we've been bringing on new partners. Yeah. We have some new partners, but this is because need is so acute. And if you'll remember back to the end of the year, it was the government shutdown, the pause and SNAP benefits, all of the worry and the anxiety about WIC and SNAP going away or being reduced, and the passage of the big beautiful bill. All of these things have contributed to this steep increase in need. Yeah. So that to say, our volunteer numbers need to increase to be able to keep up. Okay. And so what we've found is that we do have quite a number of individuals who are coming. We have volunteer opportunities every day of the week for individuals to come in. We also have group volunteers. And I'm just going to spotlight a couple of our partners. I'm going to hope that they're chamber members. Yeah, and if not, you'll know who to call.
Yeah.
So you HCA, HCA and Mission, they've been incredible volunteers for years for us. We bring diapers to the hospital and they'll wrap them in a break room, and they come to us and they'll wrap in our warehouse. They put together shelves for us. It's been a wonderful partnership. Gaia Herbs is another one. They will bring a delivery truck and we will load pallets of diapers on. They will take them back to their warehouse, and their fulfillment staff that they have there are experts at wrapping diapers at this point. So we love that so much. Behringer Construction, they're new to our community. Yes. They came in and they came in hot because they brought their trucks. They've helped us move diapers all across town. They have also helped us put together shelves.
Oh, great.
And they've helped us wrap diapers too. So that's just to name a few. I'm sorry to all of the rest that have not been included, but we have seen that there is a need because a lot of organizations or a lot of for-profit companies have opportunities for their employees to do volunteerism and to get paid for it
while they're working.
Yeah. And so we love that. We want them to all come to us, or we want them to know that they can take our products off-site. Thermo Fisher is another one that they will come and load up individual personal vehicles, take them on site, wrap diapers as a team building exercise, and then bring them back to us.
That is so wonderful.
We absolutely love those types of relationships, and really want to encourage anyone who has been thinking, I would love to do a team building activity. I would love to get that as part of what my employees are doing. It builds morale. It gets people talking. It gets just that feel-good sensation of I did something for my community. Yes. So, and who doesn't love helping babies?
I know. They're so cute. When you're saying bundle, I mean, how many go, because you're not just giving out, the box.
Right, we're not giving out the box,
How many are in a bundle?
Yeah, I should have brought one with me. That would have been a good visual.
I've seen one, but... Yeah.
So, and this is also a national best practice that we do bundle diapers because we accept diapers that are in boxes that have been opened, say
Right.
your diaper grows overnight, your baby grows overnight.
And it happens.
Yeah.
I actually gave some of mine as well as I was like looking around. I was like, oh, we are way out of this size.
Exactly. And that happens because especially if you're buying a big box, they grow so quickly. So we have drop boxes around the community, Lollipops down in South Asheville and Littlest Birds and Once Upon a Child. All the consignment stores are our good partners, right? So we have drop boxes that folks in the community can just take that size, even when it's open. We just ask them to like tape up the package so that they don't get loose and get dirty, because then we can't use them, obviously. So, but then our volunteers take what comes in and they organize them by size, and then they bundle them. Infant size diapers, so newborn through size 6, are bundles of 25.
Okay.
And then the larger sizes, 7s, 8s,
Yeah.
pull-ups.
Yeah.
Yeah. Those are 12, because at that point, your baby is most likely getting towards like the
Yeah.
potty training.
Yeah.
They're not using as many diapers a day.
At least you hope so.
At least you hope so. You know.
Yeah.
So the idea is, and there's been national research that's done to say, what is that diaper gap where because most families who are getting diapers are working. And that's a big misconception also. But what is the difference between getting to the end of the month, getting to the next paycheck for families? How many more diapers does it take so that baby stays clean, dry, and healthy? And so national research has shown it's about 25 to 50 diapers for the infant size, and it can be less for the potty training sizes. So when we're bundling the diapers, we're doing it with that in mind. And that also allows us to track how many babies we're serving. And last year we served about 30,000 babies. Yeah.
Wow. That's just spectacular that you guys have this. And I'm glad that you guys are here. It kind of blows my mind that we didn't have something like this prior to you guys starting this. And thank goodness for the original founders that saw the need to get this out in our community.
Yeah.
And now it's expanded so much. So how can we find out more information about being a business partner, volunteering, those group efforts, or maybe even if somebody's listening that has a need, like where can they find information to get those diapers?
Yeah, thank you. I will start with that one because that's the most acute, right? So we encourage everyone to call 211. It's the United Way of North Carolina. They have all of the information about where resources are. So if you need diapers, you probably need something else too. So if you're not already connected to a social service agency that can help you just navigate, then call them. Call 211. They're wonderful. They will help connect you to that next step to get the resources. So that is the first part. And then the second part is go to our website, right? So if you want to find out any more about us, we have a ton of information on our website. You can find out how to volunteer, how to donate, because of course we're a nonprofit, so we do run on funds that come from generous individuals, foundations, corporations. We don't accept federal dollars at this point, knowing that that is not a sustainable course of action for a nonprofit. So for us, our biggest source of funding is coming from our local foundations and our local individuals. And so we have lots of opportunities to get involved either through volunteerism or through becoming a donor. And I will say our Instagram, you mentioned it.
I mean, it's great.
We update that weekly, right? So it's not quite daily, but Megan is our social media queen and she puts all of the important stuff on there. So if you want to find out more, you want to see people, in action, see a little bit about what it looks like to come volunteer with us. There's great images there. If you want to hear stories from our partners about what diaper need looks like, we have testimonials on our Instagram and our website. So yeah, those are the two main places to go.
That's great. Well, thank you so much for enlightening us with what is going on in our community that some of us might not be thinking about, and bringing that to the forefront, and also being just an advocate for all these babies and parents and moms and dads and anybody that has those needs.
Yeah, thank you. Thank you so much. I really appreciate it.
Yeah, thanks again.
If you enjoyed today's episode, like, comment, and subscribe. To learn more about joining the Asheville Chamber, scan the QR code on your screen or visit ashevillechamber.org. Until next time.